welcome our three panelists on the first panel and look forward to your testimony. We'll start off with Dr. Smith.
Thank you very much. I'd like to first thank Chairman Michaud and Ranking Member Brown for the opportunity to testify today on meeting the needs of our veterans, particularly those who live in rural areas. My name is Dr. Joseph Smith. I'm the Chief Medical and Chief Science Officer of the West Wireless Health Institute. Our institute's a nonprofit medical research organization launched last year by two visionary entrepreneurs, Gary and Mary West, with the primary mission of lowering healthcare costs through the use of wireless health solutions. The West, through their family foundation, have already granted nearly $100 million to this institute to date, and we're focusing those resources to innovate and incubate promising technologies, validate their ability to lower aggregate healthcare costs, and engage, as we are today, with policymakers and other stakeholders to accelerate the availability of these solutions. Wireless sensors that aid in remote diagnosis, monitoring, and treatment support are among the innovations that will enable the Institute's mission. In general, wireless sensors deployed in, on, or near the body can accurately monitor physiologic functions including body temperature, respiration, heart rate, physical activity, blood glucose levels, tissue oxygenation, relative hydration, among many. Because of their pervasiveness and low cost, cell phones and other wireless technologies are well suited to cheaply analyze, transmit, and display relevant information and help patients, families, and health providers manage chronic disease. In this way, wireless technology can offer continuous care for chronic disease instead of the snapshot of a patient's condition routinely available at a clinician's office, and in the process, replace expensive episodic rescue with cost-effective prediction and prevention. Wireless healthcare enables a new infrastructure-independent model of healthcare, which translates into the right care at the right time, whenever people need it. For veterans residing in remote areas, this means avoiding the burden of time and expense required to make repeated visits to distant facilities. We believe the VA system has provided early validation of the value of these promising technologies. Specifically, we commend the VA for its care coordination home telehealth program, which has demonstrated a 25% reduction in bed days of care, including a 50% reduction for patients in highly rural areas, and a 19% reduction in hospital admissions by simply taking chronically ill veterans and linking them with healthcare providers and care managers through video conferencing, messaging, biometric devices, and other telemonitoring equipment. Dr. Darkin, the lead architect of this study, is on the panel to follow, and building on his success, we encourage the VA to evaluate and implement wireless health solutions beyond traditional telehealth, and that will complement and further extend the reach of the CCHT program, including wireless biometric sensors that monitor disease-specific physiologic parameters and track disease activity on a continuous basis. These technologies enable patients, providers, and family members to monitor the metrics of their conditions without a facility inpatient visit. Relevant to this opportunity is the recent announcement of the new $80 million VA Innovation Initiative meant to improve veterans' care by tapping into private sector expertise and creativity. We encourage VAI2 to accelerate the development and evaluation of more sophisticated wireless healthcare solutions comprised of advanced sensor technology, patient and population-based learning algorithms, and remotely titrated therapies for a wide range of healthcare needs. The VA's early success in the use of health technology rests in part with the physician's ability to operate across state lines. For typical U.S. clinicians, geographic limitations of practice create a serious impediment to the wide deployment of wireless health solutions and frustrates the ability of our broader healthcare systems from reaping the cost and care efficiencies enabled by these solutions. We encourage a thoughtful review at the federal level to address the interstate obstacle to widespread adoption of wireless health technology. Also imperative to extending veterans' access to wireless health technology is the rapid expansion of broadband to rural and remote areas. The FCC has noted that as many as 24 million Americans do not have access to broadband where they live. We commend the commitment to expanding broadband access in the 2009 economic stimulus bill, and we support the FCC's plan to ask Medicare program for a clear path for reimbursement for wireless health solutions. Finally, in our many stakeholder discussions, it's clear that the current lack of regulatory clarity as to which components of wireless health solutions are and are not considered medical devices from the FDA perspective is dampening investment in wireless health technology and chilling this promising engine of innovation. In summary, we encourage the VA to evaluate and deploy newer wireless health technologies within its CCHT program and take advantage of opportunities like the recently announced VAI2 initiative to develop and test biometric sensors and other solutions that facilitate remote use and remote access to care. We encourage members of the committee and Congress to support broadband expansion, as well as a clear and consistent regulatory and reimbursement environment to spur the types of innovation that will truly enable care anywhere, anytime. Following the VA's lead, Congress should consider policies that facilitate healthcare delivery across state lines, with the expansion of state-to-state reciprocity agreements being one potential first step. Thank you again for the opportunity to testify here today. I'm reminded that it was 100 years ago that Abraham Flexner wrote what is thought to be one of the most impactful treatises in American healthcare. And in that, he called out that our nation's smallest towns deserve the best and not the least adequate physicians. I think we can't wait another 100 years for that to take place, and that wireless solutions will enable the best thinking and the best minds to be present in rural areas where our veterans live. Thank you.
Thank you very much, Dr. Smith, and I couldn't agree more with that last statement.